Hello, I am Dr. Jocelyn, a urologist, and today I want to speak to you with as much clarity and closeness as possible about a topic that many men over 60 live with in silence. A topic that sometimes causes shame, fear, and is rarely shared, not even with the closest partner. Today I want to ask you a direct question. How would you feel if you reached climax with all the intensity of an orgasm, but did not see a single drop of semen come out? Maybe it has happened to you once and left you thoughtful. Maybe it happens to you frequently and you have decided to keep it quiet. Whatever your case may be, I understand. I have seen men in my practice who come in with a restless look, not knowing how to explain it. Some barely whisper it, as if confessing a shameful secret. Others tell me that they have even avoided intimacy for fear that their partner will notice. That emotional burden is as real as physical changes, and that's why today I want to invite you to lift the veil on the taboo. Because what happens in intimacy is not a minor issue. It is part of your overall health, your confidence, and your quality of life. And I'll give you an important heads up. It doesn't mean you have lost your virility or that your masculinity is at risk. What you are experiencing is a signal from your body, a message that needs to be understood and, in most cases, can be treated. But stay with me, because in the next few minutes, we will explore together the causes, the warning signs, and above all, the solutions that science offers us today. Understanding normal ejaculation. Before understanding what happens when semen does not appear, it is important to remember how a normal ejaculation works. Imagine that inside your body there is a small orchestra perfectly coordinated. Each instrument plays an essential role, and all must sound at the same time for the melody to be complete. Under normal conditions, the testicles produce sperm. The seminal vesicles provide most of the fluid, rich in nutrients and energy. The prostate, for its part, adds a special fluid that protects and helps transport the sperm. All of this comes together in the urethra, like musicians waiting behind the curtain. When maximum excitement arrives, the muscles of the reproductive system come into action. They contract rhythmically and powerfully, propelling the semen outward. It is a quick, almost automatic process, but the result of exquisite coordination between nerves and muscles. Here appears something key. Orgasm and ejaculation, although they usually happen together, are not exactly the same. Orgasm is the neurological response of pleasure and release. Ejaculation is the physical act of expelling semen. Most men experience them as a single event, but in reality, they are two distinct mechanisms that accompany each other. When both occur, the sensation is complete: pleasure, relaxation, and the visible evidence of semen. And right there lies the key to what we will explore today. What happens when that fluid does not appear, even though the sensation is present? 2. What is dry ejaculation? The term dry ejaculation refers to a condition in which a man reaches climax, feels the characteristic pleasure of orgasm, but does not see semen being released, or notices it in a minimal, almost symbolic amount. At first glance, it seems that the body has completed the full process, because the intensity of pleasure remains. However, something that has always been considered inseparable is missing: seminal fluid. This difference, although it may sound small, is what generates the most confusion. Many men tell me in consultation, "Doctor, I felt the same as always, but it was as if the orgasm was empty." That perception of emptiness is what fuels concern and, in some cases, the embarrassment of discussing the issue. It is essential to understand that orgasm is a neurological phenomenon, governed by the brain and the nerves that transmit the pleasure signal. Ejaculation, on the other hand, is a mechanical, muscular, and glandular act. The ducts contract, the valves open, and the semen is expelled. They generally occur together, but they are not the same. When the first happens without the second, that confusing feeling arises. Is my virility failing? Have I lost my masculinity? The answer is no. Dry ejaculation does not mean that desire or the capacity for pleasure has extinguished. It simply means that the body has changed a part of its usual functioning. This phenomenon has various causes, some temporary and others permanent. It may be related to medical interventions, medications, hormonal changes, or even diseases that affect the nervous system or the prostate. The important thing is to understand that behind each case there is an explanation, and many times also a solution. Main causes ejaculation. Among all the causes that explain dry ejaculation, one of the most common is retrograde ejaculation. To understand it, imagine a gate that should close firmly at the neck of the bladder during orgasm. When it works properly, that gate blocks the passage to the bladder and directs the semen outward. But if that valve remains open, the semen takes the easier path. It goes back to the bladder instead of exiting through the penis. The result is simple to describe. The man feels the orgasm but does not see semen. Many times he discovers what is happening when he notices that his urine is cloudier after intercourse because seminal fluid has mixed in there. The causes are varied. One of the most common is surgeries on the prostate or bladder, such as transurethral resection or laser interventions. These procedures save lives and improve urinary quality, but sometimes they alter the coordination of the nerves and muscles of the bladder neck. Also, certain medications for hypertension, some antidepressants, and drugs used in benign prostatic hyperplasia unintentionally relax that area, allowing semen to flow backward. Neurological damage also plays an important role. Poorly controlled diabetes, multiple sclerosis, or spinal cord injuries interrupt the signals that should close the bladder gate. I remember the case of Jorge, a 58-year-old patient who came to my office distressed after a laser prostate surgery. "Doctor, my orgasms are empty." When I explained to him that it was a case of retrograde ejaculation, irreversible in his case, but that it did not affect his potency or desire, he breathed a sigh of relief. He then understood that his virility remained intact. It was just that the path of the semen had changed. The diagnosis is relatively simple. Just a urine analysis performed right after climax is enough to detect sperm in the sample. Regarding fertility, it is true that retrograde ejaculation prevents natural conception. However, there are assisted reproduction techniques that allow for the recovery of sperm from urine or directly from the testicles. And for men who do not seek children, intimate life remains pleasurable and complete. The lesson is clear. Retrograde ejaculation does not mean a loss of masculinity. It is a physiological change that deserves diagnosis, understanding, and, in some cases, treatment adaptation. Main causes 2. Obstruction of seminal vesicles. Another important cause of dry ejaculation, less known than retrograde ejaculation but equally relevant, is the obstruction of the seminal vesicles. These glands, located just behind the bladder, produce between 60 and 70% of the total volume of semen. Their secretion contains fructose and other nutrients that nourish the sperm and provide them with energy to fulfill their reproductive function. When the seminal vesicles are blocked, either partially or completely, the semen decreases drastically or even disappears, although orgasm is preserved. It's as if the highway through which the fluid should flow is closed. Pleasure is present, but the path of the semen is interrupted. The causes of this obstruction are varied. One of the most common is old infections, such as prostatitis or urinary infections that were not properly treated and left internal scars. Another frequent reason is seminal calculi, small stones similar to kidney stones that block the ejaculatory ducts. There are also congenital cysts in the region of the vesicles or in the vas deferens, which remain silent for years and manifest in adulthood. Additionally, pelvic trauma or previous surgeries can narrow the passage of semen. The symptoms guide the diagnosis. Some men feel the orgasm as incomplete or with deep pelvic pain or persistent discomfort in the groin. Others notice that the semen appears thicker, reduced in volume, or with small clumps. Sometimes the only sign is infertility with no apparent cause, a common reason for consultation. I remember Fernando, a 34-year-old patient who came with his wife after 3 years of trying to conceive unsuccessfully. He had normal erections and a good sex drive, but he noticed that his semen was becoming increasingly scarce. A transrectal ultrasound revealed a cyst in one of his seminal vesicles. With endoscopic surgery, we were able to remove it, and months later, his wife became pregnant. The diagnosis requires specialized tests: transrectal ultrasound to see the shape and size of the vesicles, sperm analysis showing low volume or absence of fructose, and in complex cases, pelvic MRI. Treatments vary depending on the cause: antibiotics and anti-inflammatories if the origin is infectious, endoscopic surgery to remove stones or open blocked ducts, or ultrasound-guided aspiration in the case of large cysts. Recovery is usually quick and with very good results. In conclusion, obstruction of the seminal vesicles is a silent but treatable cause of dry ejaculation. Identifying it in time allows for the recovery of both sexual function and fertility. Main causes 3. Hormonal factors. The third major cause of dry ejaculation is related to hormonal balance, especially testosterone levels. This hormone, produced mainly in the testicles, is the engine that regulates both sperm production and the functioning of the prostate and seminal vesicles. Additionally, it stimulates sexual desire, enhances sensitivity during intimate acts, and is involved in the contraction of the muscles responsible for ejaculation. When testosterone levels drop significantly, the system begins to fail. Initially, a man may notice that the volume of semen is lower or that it becomes clearer and more watery. Over time, other signs appear: decreased libido, less firm erections, less intense orgasms, and even dry orgasms. Generally, chronic fatigue, loss of muscle mass, and mood swings also occur. It is important to remember that aging in itself should not equate to a total loss of vitality. What happens in many cases is hypogonadism, that is, a hormonal deficiency that requires medical attention. This can be primary, when the testes do not respond adequately, or secondary, when the problem lies in the brain, in the pituitary gland, or in the hypothalamus, which do not send the correct signals. The diagnosis is based on a comprehensive hormonal analysis that includes total and free testosterone, as well as LH, FSH, prolactin, and thyroid hormones. A low testosterone level, especially when accompanied by symptoms, is indicative of a disorder that needs to be treated. The treatment depends on the cause. Testosterone replacement therapy can be administered via injections, gels, or patches, improving energy, libido, and semen production. However, it is not the best option if the man wishes to have children, as it may reduce fertility. In those cases, there are alternative medications that stimulate the natural production of testosterone and sperm. In short, hormonal decline is not a mere detail of aging, but a signal that should be addressed. Restoring balance can mean regaining energy, desire, and a fulfilling sex life. Warning signs and serious associated diseases. So far, we have seen causes that, although concerning, often have solutions. However, dry ejaculation can also be a warning sign of something more serious, a symptom that should not be overlooked when it appears alongside other signs. First, let's consider urological cancers. Prostate cancer, as it grows, can obstruct the ejaculatory ducts, resulting in orgasms without semen or with blood. In more advanced stages, it causes pain during ejaculation and increasingly intense urinary symptoms. Bladder cancer, on the other hand, alters the release of semen when it invades the bladder neck or urethra, and is often accompanied by hematuria. Testicular tumors can also manifest as infertility and absence of seminal fluid. The other category is neurological diseases. Poorly controlled diabetes is the most common cause of nerve damage in the reproductive system. Multiple sclerosis, Parkinson's disease, spinal cord injuries, or strokes also disrupt the signal between the brain and the sexual organs, causing dry or incomplete orgasms. Additionally, there are less common but equally relevant autoimmune and systemic diseases. Lupus can inflame the vessels that nourish the prostate and seminal vesicles. Scleroderma hardens internal tissues, blocking ducts. And sarcoidosis can form granulomas that interrupt seminal flow. When to see a urologist immediately? If dry ejaculation appears suddenly, if it is accompanied by pain, blood in the urine or semen, loss of genital sensitivity, weakness in the legs, or persistent fever. All of these are warning signs that indicate a serious problem that cannot wait. In conclusion, although dry ejaculation is often benign, there are situations where it becomes a crucial warning. Listening to your body and consulting in a timely manner can make a difference, not only for your intimate life, but also for your overall health. 3. Emotional consequences and quality of life. Beyond the physical aspects, dry ejaculation has a profound impact on the emotional life and self-esteem of older men. Many feel that they have lost part of their masculinity, or that their sexual performance is no longer the same, leading to anxiety, frustration, and in some cases, avoidance of intimacy. It is common to hear stories of men who distance themselves from their partners, who avoid moments of closeness out of fear of being judged or feeling incomplete. The emotional burden can be as heavy as the physical symptoms themselves. Shame and guilt reinforce a negative cycle, affecting confidence and quality of life. However, it is important to understand that not everything is lost. The absence of semen does not mean a loss of desire, pleasure, or the ability to enjoy intimate contact. Many men maintain normal erections, intense orgasms, and a satisfying sex life. The first step is to recognize that this is a physiological change, not a personal failure or a punishment of aging. Understanding the cause and seeking medical help allows for the recovery of peace, self-confidence, and emotional connection with the partner. Accepting and addressing the situation openly is key. It not only improves sexual health, but also self-esteem, confidence, and overall quality of life. Practical tips from Dr. Jocelyn. Living with dry ejaculation can be challenging, but there are practical strategies that help manage the condition and maintain confidence in intimacy. The first, never ignore sudden changes in your body. A sudden onset of dry ejaculation or any associated symptoms like pain, blood, or decreased desire requires immediate consultation with a urologist. Managing chronic diseases like diabetes and hypertension is essential, as they directly influence sexual function and the nerve coordination necessary for ejaculation. Maintaining a healthy lifestyle helps prevent complications. Regular exercise, balanced nutrition, and adequate sleep strengthen vascular and muscular health. Another key piece of advice is to break the silence. Talking with your partner and a specialist not only clarifies doubts, but also reduces anxiety and improves intimacy. Understanding that dry ejaculation is a physiological change, not a personal failure, helps regain emotional calm. Finally, following medical advice and attending regular checkups allows for adjustments and treatments, improves sexual function, and, when necessary, explores assisted fertility techniques. The combination of early diagnosis, healthy habits, and open communication constitutes the best strategy for maintaining a satisfying intimate life and preserving masculinity without guilt or fear. In summary, dry ejaculation is not a sentence of loss of masculinity nor the end of sexual life. It is simply a signal from the body that deserves attention, understanding, and, in many cases, treatment. Understanding its causes, whether surgical, hormonal, obstructive, or neurological, is the first step to regaining peace of mind and confidence. I have seen men who, after receiving a clear guidance and medical guidance, regain self-confidence and enjoy intimacy without fear or shame. Cases like those of Jorge, Fernando, or Cayetano show that, although the path may require adjustments or interventions, vitality and pleasure remain possible. Listening to the body, attending regular checkups, and maintaining healthy habits, exercise, balanced nutrition, sleep, and management of chronic diseases reinforces not only sexual function, but also overall health and self-esteem. Do not let silence or resignation control your intimate life. Speaking up, staying informed, and taking action in a timely manner can transform the experience, restoring confidence, well-being, and emotional connection with your partner. If you found this information helpful, please leave your comments, share your experience, and remember, consulting a specialist and understanding what is happening in your body always opens the door to solutions and hope. Your masculinity and intimate life can remain full and satisfying, even in the face of dry ejaculation.